Greetings once again. It's a pleasure to be back and it's a pleasure to be having this conversation with you. So, this week I'm going to talk about pharmacy practice with a focus on service to persons living with disabilities. I know this is not a conversation that we have in most of our practices, and especially in the healthcare space, this is not something that has been given much attention and much focus, but then there is need for it. And when you look at it from a point of a need, then you ask yourself, from a country perspective, from an international perspective, we all believe and commit to the fact that every human being should have access to the quality, safe, and effective medical services and products that they need to be able to lead a full and healthy life as much as is possible. And even in the Kenyan constitution, that is provided for. And if that is provided for, then you ask yourself, what happens to the persons with disabilities? And disabilities at this point is not only the physical disabilities, because if somebody, let's say for example, has a physical disability, they might not access certain facilities, but then if they get somebody to get them to the doctor, or even the doctor visits them in their own local communities, that interaction can happen if they are able to have a conversation with the physician, express themselves, the lab works will be done and all that, which is good enough. But what happens to the people who are deaf? The people who cannot express themselves? Do we have doctors who are competent and proficient in sign languages? Do we have pharmacists who are actually endowed with the knowledge of sign language and are able to communicate in sign language to the deaf community? That's something that we need to ask ourselves about. And it is very critical. When you look at disability, there's the psychosocial disabilities that we're looking at. When you look at the mental health space, there's a consideration of people with mental illnesses to be disabled in certain ways, and therefore there are special cares and special needs services that need to be provided for them. How do we look into this? And for me, I look at it from pharmacy practice standpoint, where we ask ourselves, as a pharmacist and as a pharmacist in practice, my responsibility is to ensure that my patients, regardless of where they are and regardless of the domain of practice where I operate, they're able to get the right, safe, and effective quality medicines across the value chain. That means, from a research perspective, we're doing research with the indigenous communities and as diverse as possible so that we are able to produce the right product for the right treatment, for the right condition, and that effectiveness, safety, and efficacy of the product and quality as well will not be compromised on. But then, once that is done in the lab work, the production facility does robust and effective manufacturing capabilities, and all the quality products are now available in the market. That is where we now move to the point of care service delivery. Imagine you're a pharmacist running your community pharmacy, and then somebody who is deaf comes to your pharmacy. How do you communicate with them? How do you understand what their need is? And assume in this case they've not seen a physician, and therefore you are the first point of call and the first point of contact. And in that case, then they're expecting you to be the person to actually understand their condition, express it, and actually advise them on how to take care of themselves. How will you do that? On the other note, this patient comes to you, and the person with disability, I'm talking about it from a deaf perspective, comes to your pharmacy. They have a prescription that has been written, there are lab works that were performed and all that. Then you give them the medicines. How do you tell them to take the medication in terms of the different intervals as necessary? And how do you express it to them and explain it in a way that they're able to understand? That's a critical bit we need to ask ourselves. How are we looking at attending to this particular community? Somebody would be asking, why is it that I'm talking about this? Because I feel like there is a need for us as healthcare workers and specifically pharmacists to ask ourselves, how do we serve communities and especially persons living with disabilities? Because it is critical. And even when you look at the Disability Act of Kenya, provides that they should be able to have access to the right quality healthcare services and products without suffering any hardships and any barriers to that access. And if that access needs to be guaranteed, one, we need to ensure that healthcare services are available across the country for everyone and anyone. But once we've made it accessible, we need to be cognizant of the uniqueness of the needs of persons with disabilities. If you're talking about somebody using a wheelchair, if they're not able to climb the stairs into your facility, they'll never get the services that you're offering unless you go to where they are. How likely is it for you to leave the pharmacy to go dispense the medication to them in their homes? Almost impossible. Therefore, they'll be using third parties, intermediaries in service delivery. Is that what we would want for care? I hope not. I don't think it would be the right approach. So the question is, how do we make our facilities more accessible? Disability friendly healthcare facilities. Do we have ramps in the hospital that we are going into? And how effective, how seamless is it for the people with disabilities to access them? That is in terms of the physical accessibility. Do we have sign language interpreters, or if not sign language interpreters, do we have individuals who are actually trained, the pharmacists with training and skills in sign language, so that they're able to communicate with the patients from the deaf community who might be visiting their facilities? How would that look like? Individuals with psychosocial disabilities, do we understand the nuances around relating with them and engaging with them? And how do we consider that need to be a critical provision in our healthcare services, so that beyond even looking at the physical condition, the disease that they're presenting with, we're able to understand them, we're able to relate with them? It is an important thing. And I think there's a substantial opportunity that is there for us, one, to drive the advocacy, two, to offer quality services to them, and to build ourselves as the experts, as the go-to person who will be there to listen, to take care of them and support them as much as it's necessary. I have a brother who is deaf. I engage and communicate with him. But do we have other pharmacists who are able to support them? And most of the times we don't operate, we don't stay together. What happens when he goes to the hospital? Who gets him the right medication that he needs? Does he get the explanation on how to use the medicine? And how effective is that communication? If he has to text me, or he has to have a video call with me so that I can explain the medication, then you're asking yourself, what if there's somebody who has the same disability in another location whose brother is not a pharmacist, who will not have the medical background to help them explain and interpret the case of use of that medicine? How does that transform our practice? There's so much questions, so much to be done, but less of us are doing that work. And I think there's some room for us to get into that space and specifically deliver that, saying we are going to package information that is palatable, that is understandable and comprehensible to them, but also being there to engage with them and knowing that we have to be cognizant of their needs beyond just practicing as a pharmacist. We are practicing as a pharmacist because somebody needs our pharmaceutical services and care solutions. And if that person needs our services, then we need to be in a position to offer it. The only way we can offer it is once we understand the market, we understand the people who need our care, and we're able to do it. Luckily enough, I've seen some pharmacists who are actually getting into that space, and I love this because these are people who show me that in a way, I'll be guaranteed that in case I ever have a need, I'll have somebody that I can refer my siblings to, my brother to. I have somebody that I can refer other patients who might get to me, but I'm not in their best position to support them because somebody did the work and somebody is moving on that frontier. So for me, when I think of these and I talk about these, Dr. Stacy Muriuki, congratulations, keep at it. Dr. Jen Jama, keep at it. Learning sign language with a focus on how do you be the best version of yourself as a pharmacist to serve this unique population and this unique group of people who might need the services of a pharmacist but they're never able to get it. But my challenge again is for all of us pharmacists in our different spaces, how about we consider learning sign language? How about we be more collaborative and engaging and see how do we ensure that the disabled community have access to the services that they need? And if you're able to do that, I think there'll be a lot more difference. And the opportunity is that, one, there are people with disabilities, there are our mothers, our fathers, our siblings, our children, our nieces, our cousins. All of these people are in our communities. We live with them. They're not outsiders. They're not in the species that are another species that we don't even know about. They are in our communities and they are our people. That is one. And that is an opportunity there, but because they need healthcare services, and diseases don't choose who to inflict. Diseases come and go. They come to everybody and anybody. The only thing that is common is we all have to work together to deliver healthcare services. So the opportunity is there. The level of impact is to understand that, do they have access, the physical access? Two, are you able to communicate? Because in healthcare, the most critical bit is communicating and understanding what whichever party is talking about. Are we able to communicate? That will be our first impact point. Learning a language will help us, especially sign language in this case. And then beyond that, being available and being accessible and committing your time and yourself to be able to deliver that service to them. And positioning yourself as a unique service provider for particular segments of the population. Because for a fact, not all of us are going into that route. But if not all of us are going, then it means some of the specific individuals who are looking at attending to this patient population, they'll make a win by supporting this patient population and being there for them. And I hope and wish that for all of us in our different lines of practice, we commit to integrate and actually engage and offer services to people living with disabilities, and we drive practice to the frontier that we're hoping for, that will ensure equality in access and availability of services for all. If you engage with the conversation and you feel like this is something impactful to us, let's engage and see what can we do in our different spaces. And if we can commit to work together, we'll make a difference. If you enjoy the conversation, subscribe to the channel, share it with some of your colleagues and your peers, and let's drive the movement together to make healthcare services more accessible and available to everyone, and pharmacy as a practice to be of value and impact to the communities that we serve. Thank you and have a good one.